Diabetes is an illness that can affect people of all ages, and is brought on by excessive blood sugar levels. Diabetes has a variety of side effects, making it a condition that needs to be taken carefully and closely managed. When you have diabetes, it's important to take care of your eyes because the condition can create eye problems that, if not properly managed, might worsen and perhaps cause irreversible eye damage. Here are 4 ways that diabetes can harm your eyes. 1. Glaucoma. An rise in the pressure inside the eye is what causes glaucoma. When the eye's fluid cannot be properly evacuated, pressure forms. If not monitored and properly treated, this can result in damage to the blood vessels and nerves inside the eye, decrease vision, and eventually result in blindness. Diabetes increases your risk of developing neovascular glaucoma, a rare form of glaucoma. This uncommon form of glaucoma is brought on by the growth of new blood vessels on the iris, the colored portion of the eye, which obstructs the normal flow of eye fluid and raises the pressure inside the eye. While neovascular glaucoma is difficult to treat and may require laser surgery or implants to control the glaucoma, ordinary varieties of glaucoma can be managed with eye drops and possibly surgery if necessary. 2. Diabetic retinopathy. The most well-known side effect of diabetes, diabetic retinopathy, should be addressed seriously because it can result in blindness. The retina, located at the back of the eye, is impacted by diabetic retinopathy. The component of the eye called the retina is responsible for converting the light we see into signals, that are then transmitted to the brain via the optic nerve, and processed there to create the images we see. When your retina's tiny blood vessels become blocked, leak, or expand abnormally as a result of elevated blood sugar levels, you develop diabetic retinopathy. Diabetic retinopathy comes in 3 different forms. A. Background diabetic retinopathy. This sort of retinal alteration is very early and usually has no effect on vision, but it needs to be closely watched to prevent worsening. B. Diabetic maculopathy. This form occurs when the macular has been affected by background diabetic retinopathy. Since it offers center vision, the macular is essential for providing effective eyesight. Diabetic maculopathy can impair vision. C. Proliferative diabetic retinopathy. This kind develops when pre-existing diabetic retinopathy worsens. Reduced blood flow to the retina results from the above 2 types of damage or blockage to blood vessels in a significant area. The body tries to make up for this by developing new vessels on the surface of the retina, but these veins are frequently fragile and bleed, which can impair vision. A retinal detachment may result from the scarring that the bleeding also has the potential to bring about. Although retinal detachments can be repaired, there are situations when this may not be possible, leaving the patient blind or with vision loss. 3. Cataracts. Although cataracts are exceedingly prevalent and a natural part of the aging process for the eyes, people with diabetes can experience cataract development earlier and more quickly. The aging, clouding, and rigidity of the eyes are the main causes of cataracts. Vision blurriness and glare or halos are common cataract symptoms, especially at night. Typically, cataracts are simply removed by cataract surgery, and in their place, an artificial intraocular lens is inserted to restore vision. 4. Blurred vision. Blurred vision may be brought on by other conditions, such as cataracts, but it is sometimes a sign of diabetes and can be treated with a simple adjustment of blood sugar levels. High blood sugar levels can make your eye's lens bulge, which makes your vision appear blurry. You might only need to bring your blood sugar levels back under control and within acceptable range to address this. The vision blurriness might not go away for a few months. Keep in mind to have frequent eye exams if you have diabetes. A yearly diabetic eye test should be offered to anybody with diabetes over the age of 12, and it's crucial that you attend. Your vision may be saved if diabetic eye disorders are caught early. Thank you for watching and please subscribe for our next video.